2, that's the orange colour on the slide, we will expect to see, in some ways, an increase in cases because we're having an increase in detection numbers. So this is a good signal. We are flattening that curve. It rose sharply and it's levelled off. But don't be surprised if cases do increase a bit as our actual testing increases as well. Next slide, please. So this slide demonstrates the people in hospital with confirmed COVID-19, and this has fallen obviously very markedly in London. We can see how hard the NHS was working, particularly in the first week in April, and the success that that's had. And in fact, I think on the number of inpatients who've been diagnosed with COVID in the last 24 hours, for the first time in many, many weeks, this has fallen below 1,000. So this is real success, and many other success stories, as you can see, with many areas working really hard. But we do need to keep our social distancing measures going. We must not allow those peaks to start curving upwards again. Next slide, please. And again, critical care bed use, we can see a sharp rise. I know there were concerns in members of the public about whether our capacity would be sufficient. It has always been sufficient, and increasingly on a day-to-day basis as we manage the disease and the epidemic in the UK, the numbers of beds available has significantly risen. So there is a lot of hard work, of course, on the front line, and we mustn't underestimate that by NHS colleagues, but capacity is continuing to increase as we move forward. Next slide, please. And then, sadly, of course, we report the deaths which happen. These are deaths which are confirmed in hospital. They're not reported until all the paperwork is cleared. So again, you will see some variation in the reporting, but generally an increase in deaths as the epidemic spread, and then very gradually but subtly an overall decline, a trend in downward death data. Next slide, please. And then finally, this tries to give an indication. It's very difficult because of the difficult comparisons of death data between countries, but to indicate how the UK is doing in relation to other parts of the world. The far right blue death line, which you can see marked as UK hospitals only, indicates the data that we've just seen on the preceding slide. And then increasingly we are trying to provide a much broader indication to ensure that we're capturing deaths which are not just in hospital, but that we know will be happening in communities, to make sure that we're clear how we are managing the disease, and to make sure that we are looking after those who are most vulnerable. Thank you.
Thank you very much, Jenny. I'd like to turn now to Hugh Pym, the BBC. Hugh.
Thank you.